Now let's look at some clinical conditions with regards to swollen mass of the in the inguinal region or the greon. A patient may present to the hospital with a mass, with a swollen scrotum, maybe a right hemiscrotum. It's very swollen. Now, there are differentials we could look at. It could be hydrocele, it could be hematocele, it could be direct inguinal hernia or indirect inguinal hernia. Now, what do? The first thing is we want to rule out if it is a hydrocele. Now, in hydrocele, you do a trans illumination. In a dark room, you put a light there and shine a light through the scrotum. If it is red, it means that it is hydrocele. If it is not red, then it means it is not hydrocele. So we rule out hydrocele. We're going to talk about how hydrocele is formed. The other thing is the hematocele. Hematocele is a collection of blood within the space. Now, we did not talk about the layers of the scrotum. The layers of the scrotum from superficial to deep will be the skin, will be the dartos fascia, would also be we have the processus, the tunica vaginalis. The tunica vaginalis has parietal layer of your tunica vaginalis and the visceral layer of the tunica vaginalis. The space between the parietal layer of the tunica vaginalis and the visceral layer of the tunica vaginalis is the cavity. Now, you can have excessive production of fluid in that cavity. Remember that the essence of the production of fluid is to lubricate the movement of the testicle in that sac. Now, you can have crazy production of this fluid, which can lead to hydrocele. That is hydrocele. However, if you have a torsion or rupture of the testicular artery, you can have hematocele, which could be as a result of a trauma, a blow, or some MVA motor vehicle accident has happened to this guy, and they have blood in that space. So that is hematocele. It's usually very painful, and it's a surgical emergency to stop the bleeding. Now, for hernia, if it is a direct or indirect hernia, it is usually painless. People do not present with pain, except if it has stayed there for a long time and the loop of the intestine is strangulated. So we can have reducible hernia and non-reducible hernia, and it can be strangulated or incarcerated. If it is strangulated, it means that the neck of the hernia sac is holding like that the intestine, so it cannot move. Before that, the intestine can actually go inside and come out again. But at this time, it is hooked, it is stopped, it cannot move. And because it is stopped, it will stop blood supply from supplying the distal end of the intestine. So necrosis can take place, and it can become so swollen because the venous return is blocked, and you can have bacteria seeping out of that region, and you can have generalized sepsis. Now, you have to quickly reduce that. You have to quickly repair that. Repair of a hernia is called herniorrhaphy. And if you cut off the hernia, it is herniatomy. So these are the two different terminology you have to understand. Now, we have a condition called cryptorchidism. Cryptorchidism is undescended testicles. During the embryological descent of the testis, it is arrested somewhere in the inguinal canal. That can lead to a condition called cryptorchidism. And if after a month or 2 months the testes are not reduced, they have not returned into the scrotal sac, we have to surgically return them into the scrotal sac. Otherwise, it may become malignant if it is left there. And I hope we do have a nice and beautiful stay at home. Have a good day. Thank you very much.